Good morning, everybody, and Happy New Year. So, my presentation is on personality disorders. So, personality disorders, we're going to talk about what personality disorders is all about, the types of personality disorders, the causes of personality disorders, diagnosis, treatment, and a brief conclusion. So, personality disorders are a group of mental health condition characterized by enduring patterns of behavior, inner expression that deviates from cultural expectations and cause significant distress in a personality in a person, social or occupational functions. So there are types of personality disorders, and we can separate them in cluster A, cluster B, and cluster C. So we're going to look at some of the personality disorders in cluster A. So cluster A, we're going to talk about paranoid personality disorders. This is when a person kind of have a distrust or is suspicious feeling about others without any significant base. The person is just kind of suspicion about anything. You give the person food, the person is suspicion about, oh, you might have poisoned it, and you give the person drinks, or you might have put something in it. Those kind of people, is always good to serve them in that stand in front of them when serving them or giving them what they need, because they are kind of always suspicious of everything happening around them. So we have a schizoid personality disorder. This is kind of detachment from social relationship and limited to emotional expression. And then we have the schizotypal personality disorders. That's discomfort, acute discomfort in close relationships. So we're going to talk about cluster B, which is kind of dramatic and emotional. We are going to start with the first one, which is antisocial personality disorder. So the antisocial personality disorder is somebody that has disregards for other people's rights and lack of remorse about people. And we are going to talk about borderline personality disorder, which is the second, which is instability in relationships, self-image, and emotion with an impulsive behavior. We're going to talk about the third one, which is historic personality disorder. This is excessive emotional and attention seeking behavior. Then we have the narcissistic personality disorder, which is kind of grandiosity, like a need for admiration and lack of empathy. We see that in a lot of people. We're going to talk about cluster C, which is the cluster C is made up of, is most about being fearful. We're going to talk about the first one, which is avoidance personality disorder. It's kind of social inhabitation, feeling of inadequacy, and the person is kind of has kind of increased criticism, if I can say it like that. We have a dependent personality disorder. That's excessive need to be careful, leading to submissive and clinging behavior. We have the third one, which is obsessive compulsive personality disorders. That's preoccupation with other line perfection and control. So now we're going to move into the causes. What I want us to know is that the exact cause of personality disorder is not fully like understood, or we can pin it to this, that this is actually what is causing personality disorder. No, but we believe that the personality disorders arise from a combination of genetic, biological, and environmental factors such as childhood trauma, neglect, family history of mental disorder. So we have some of diagnoses that are typically made by the mental health profession based on personality disorders, such as these are diagnoses that mental health professional can actually do to understand the personality disorder of an individual. We have a thorough clinical interview. You can interview the person to get to know a lot of things, observe the individual's behavior, assess the individual's pattern of functioning, and we have a criteria outline in the DSM-5, that's Diagnosis and Statistic Manual of the Mental Health. You can actually do this to understand the personality disorder of an individual. Treatment, we have psychotherapy, we have medications. We have medications that are there to treat symptoms like depression, anxiety, though no medication specifically treat personality disorders. We have support groups, like peer groups can provide understanding and coping strategies. Now, to conclude, we're going to say why personality disorders can be challenging to treat. Many individuals show improvement with the right combination of therapy, medication, and support. And we should not forget that early intervention and ongoing treatments are the key. Thank you for listening, and I hope I did a wonderful presentation.